Gosh, my name is Monica Lopez. I work with Indian Health Service Diabetes Prevention Program, and what we do in our program is we promote healthy lifestyles not only for the student but the families and the community. And what I'm doing today here is promoting the 5210 concept, and what it stands for is 5 stands for 5 fruits and vegetables every day, no more than 2 hours of screen time that includes TV, computer, video games, 1 hour of exercise every day, and 0 sugar drinks. If the children and the family can incorporate these healthy habits, then we can have a child maintain a healthy weight, because a lot of times when the child does not maintain a healthy weight, is too overweight, then they'll run into complications such as diabetes, high blood pressure, over the long term, certain types of cancers, and even their liver enzymes can be not good. And it can even affect their liver, which would lead to cirrhosis. So we just want healthy children all the time, so we want families, members, parents to be aware to take a role in promoting healthy habits for their kids. We have health technicians that go to the schools, they talk to children about nutrition, they do physical activity with them, and we also do some classes to kind of get parents more aware of healthy habits, but it's the parents that we really need to pull in. And we try and do a teach-back method. I'll tell the kids about the 5210 instead of just giving them a sticker, but I want them to repeat back what I've told them, otherwise they'll remember it more if they say it to themselves out loud. Parents have made some comments, but not too many questions. Not that much.
But do the kids understand the consequences?
The consequences, maybe some kids, especially during pregnancy. It begins even before pregnancy, just having a healthy body, because a lot of mothers, if they're too overweight, when they get pregnant, they can have gestational diabetes and eventually leading to diabetes, and it's not good for the baby in the womb either. We're available. You can call us at the Sal's Hospital, area code 520-383-7331. If you want us to come by to talk to your organization, to your family, we can do classes, we can do a presentation.
I'm Dr. Larry Smith. I work at the Sal's Dental Clinic, but I also work at the San Simon Dental Clinic, and I'm going to talk to you about tooth care. You know, there's a lot of things about tooth care, but you know, the basic, most important thing is to spend time cleaning your teeth at least a couple of times a day. You know, using a toothbrush with a fluoridated toothpaste and some floss, and you know, just clean your teeth real thoroughly, especially after meals. And you know, that's taking care of things at home, but it's important to also come in and have your teeth checked at the dental clinic, like where I work. And it's important to catch problems. Even with good brushing, sometimes you can get cavities or you can get gum disease, and those kinds of things need to be professionally taken care of. So that's what I'd say is the most important things about tooth care. Brushing, flossing at home, and then having a professional evaluate your teeth from time to time. The germs in our mouth need about 10 minutes to break down a sugar into acids. That's how they get cavities. So if there's a constant exposure to sugars and then a failure to remove those sugars, that's when decay can happen. You know, and children don't get gum disease. You hear the word gum disease or periodontal disease. Adults get that. There are rare conditions where children can get gum disease, but those are rare issues. It's mainly the cavities that plague children's teeth. Children's teeth are more susceptible to cavities too. They're thinner enamel, and they just seem to get a cavity a lot easier than an adult tooth does. And with children being as young as they are, they maybe don't have the ability to brush as well, and so that's why parents need to help brush the teeth and make sure that they're clean. Yeah.
My name's Yvette Gonzales. I work for the dental clinic. I was just explaining to the lady that on Fridays is when we do our scheduling for exams, and they're scheduled for the following week. And that's when we set up the exams. We do the cleanings on 12 and under, and then the adults are rescheduled to come back to have their cleaning done with the hygienist or with the dental assistant. Our phone number is 520-383-7341.
Hello, my name is Sharon Irmo. I'm from the Child Welfare Division, Thon Nation. I'm currently detailed to be the foster care residential specialist. Child Welfare here is presenting brochures on our program. We actually have Child Welfare, who is the more like Child Protection Services. And then we also have the ICWA unit, who is Indian Child Welfare Act. They deal with tribal and state. And then we also have the Family Preservation Program, who try to get the families to work together. That way they can work towards getting their children back. And right now we're currently trying to recruit foster parents because we don't have too many Autumn foster parents. A lot of times our children have to be transported to Phoenix for residential homes. That we have our contracts up there. So we're trying to recruit more Autumn foster parents so that the children can stay here on the nation. You have to be at least 18 years old or older. It doesn't matter if you're married or single. You have to have your own home. And we do a federal and local background check, and that needs to be updated yearly. There's an application, there's a packet that needs to be filled out. Once that's all complete and taken care of, we do what we call as a home study. We go into the home, we make sure that the home is suitable for children to live in, and then there's also an environmental health study that's done within your home.
So how big is the problem?
It's pretty big right now. We don't have, like I said, we don't have too many Autumn parents. We do have other tribes that are foster parents, and then we have non-natives.
And what is the main reason these kids are needing foster homes?
A lot of neglect. A lot of neglect is happening, and a lot of, unfortunately, sometimes when a child's removed, we're required to first find family. But when we find the families related to the children, we have to still do that background check. And a lot of times it doesn't come back clean. Therefore, we try to seek more family. And a lot of times family just says, I don't want to be a part of it. I can't deal with it right now. So we have to ship them off to, and I hate to use that word, but we have to send them off to residential homes in Phoenix, Glendale area. And then in that time, we're still trying to match foster parents with them. And our foster homes are usually at capacity level 2.
So how many kids are we talking about?
We're talking at least 86 who are in residential homes now. At least 86 children, ranging ages from 0 months to 17 years old. And then in foster care, currently we have 34 children. And like I said, we're really in need for foster families.
And what kind of prevention are you doing?
Like I said, we have the Family Preservation Program, and they do classes such as motherhood, parenting. They even have fatherhood. They bring the families in for court. They try to counsel them to get their lives back together, and that is it's sometimes successful. Other times parents start off doing a good job, then they slow it down a little, but then eventually they come back. And our whole purpose here is to reunite the children with their families. We are located at the health complex off of 86, and our phone number is 520-383-6100. And you can either ask for myself, Sharon, Ramon, because I deal with the foster homes and residential homes, or just ask for the supervisor, who is Sylvia Lopez there.